Why is weight loss so hard for stroke prevention? Weight loss can be a tough journey, especially when it comes to preventing strokes. There are several reasons behind this challenge that stem from biological, behavioral, and environmental factors. Obesity is a major risk factor for stroke, particularly ischemic stroke. Excess body fat can lead to issues like insulin resistance, high blood pressure, inflammation, and abnormal cholesterol levels, all of which increase the risk of having a stroke. While losing weight is crucial for reducing this risk, maintaining that weight loss often requires significant lifestyle changes that can be difficult to implement and sustain over time. One of the main reasons weight loss is hard is due to complex metabolic and biological factors. When someone is obese, their metabolism and fat distribution change in ways that can actually promote a higher risk of stroke. Even individuals who are considered metabolically healthy can still face increased risks over time. When trying to lose weight, the body may adapt by changing hormones that regulate appetite and energy use, making it harder to shed pounds and easier to regain them. These biological responses can be frustrating, as they often counteract efforts to lose weight. Behavioral and psychological challenges also play a significant role. Achieving weight loss requires consistent changes in diet, physical activity, and overall behavior. After a stroke or transient ischemic attack, many patients may experience physical limitations, fatigue, or cognitive issues that make it tough to adopt and stick to healthy habits. Emotional factors like stress, depression, or a lack of motivation can further complicate weight management efforts. To effectively lose weight for stroke prevention, a team-based approach is often necessary. This means involving dietitians, physical therapists, psychologists, and medical professionals. Ongoing support from this multidisciplinary team is crucial to prevent weight regain. Unfortunately, many healthcare systems may not have the resources or structured programs needed to provide this level of support, which can limit success for patients. Another challenge is the limited high-quality evidence on how weight loss interventions directly impact stroke outcomes. While we know that obesity is linked to an increased risk of stroke, there is a lack of large, well-designed studies that specifically show how weight loss reduces stroke incidence. This means that while clinical guidelines emphasize the importance of weight management, they also recognize the need for more research to find the most effective strategies for stroke prevention. For stroke survivors, physical limitations can create a cycle that makes weight loss even more difficult. Mobility impairments or weakness can restrict physical activity, which is a key part of losing weight. This can lead to weight gain, which further increases stroke risk and complicates recovery. Environmental and socioeconomic factors also play a role. Access to healthy foods, safe places to exercise, and social support can vary widely. These barriers can make it harder for individuals, especially stroke survivors, to achieve their weight loss goals. In practical terms, successful weight loss for stroke prevention involves addressing these challenges through personalized, sustained behavioral changes and medical management of stroke risk factors. Early intervention, ideally before or soon after a stroke or transient ischemic attack, can improve outcomes by stabilizing vascular risk factors and enhancing mobility and functional independence. Major health authorities recommend referring patients to intensive, multi-component behavioral programs to support their weight loss journey. In summary, weight loss for stroke prevention is challenging due to complex biological factors, behavioral hurdles, physical limitations after a stroke, and systemic barriers to lifestyle changes. Despite these challenges, managing weight remains a critical aspect of reducing stroke risk and improving long-term health outcomes.